Good morning, everybody. I'm Megan Taylor. I'm one of our directors in School Base, and I'm bringing to you understanding and managing anxiety and depression. Why are we kind of bringing this topic to you? We really want to bring some education and really understand the common mental health challenges of anxiety and depression, really understanding their symptoms, triggers, and effective coping mechanisms to manage those symptoms of depression and anxiety. The reason this is important is that anxiety and depression are two of the most prevalent mental health issues worldwide, and their prevalence has only increased in recent years. So, addressing these topics can help individuals understand their mental health better and learn practical strategies to manage them. Let's start with depression. So, I have taken our symptoms from our Diagnostic and Statistic Manual of Mental Health Disorders. This helps just give us a list of symptoms to kind of better understand the diagnosis, understand symptomology, how it impairs functioning. So what we first start out with is the criteria for this has to last at least 2 weeks, during which there is either depressed mood or a loss of interest or pleasure in activities that you once found pleasurable. So those are the two main symptoms, but then we go into some more specifics here. So either one of the symptoms will be depressed mood, the other one will be loss of interest. And then you'll see that there's some other symptoms below as well. So this could be a change in weight loss or weight gain. It could be a change in sleep. So sleeping too much or not sleeping enough. Having some issues with feeling either restless, so feeling like you're kind of driven like a motor, or feeling like your movements are really slow, including speech. You may experience fatigue or loss of energy. Having feelings of worthlessness, or this could look as excessive guilt, having trouble thinking or concentrating or making decisions. One of the other symptoms too is just thinking about death or having suicidal ideation or suicidal thoughts. Another thing that we want to think about when we're talking about depression is how it impacts our functioning. So we may have these symptoms, but we also have to have that distress or impairment. Could be in our social relationships, could be at work or school with family, things like that. And it can't be directly under the effects of a substance. So that's just kind of explaining what depression is. So let's kind of talk about how does this come about? How does depression get triggered? So obviously depression can be triggered by lots of different things. It could be stressful life events going on. Maybe there was a significant loss, divorce, financial issues happening. Maybe you're also experiencing chronic illness or pain. So a lot of the comorbidity that can kind of happen may be in line with having like heart disease or having cancer, having a chronic pain disorder. So depression is often triggered from that as well. Having past trauma or abuse that hasn't been worked through yet. So this could be physical, emotional, or sexual abuse. Experiencing social isolation or loneliness. So feeling like you have a lack of support or you're feeling excluded from social situations or groups. There's also a strong genetic component or family history component. So if you had family members that have had depression or are diagnosed with depression, there's a correlation with also having this through genetics. You may be going through some hormonal changes. So maybe pregnancy, menopause, or could be thyroid related. So it could be other medical disorders as well. Substance use is also connected. So struggling with alcohol, drug use, or even medication side effects. Struggling too with some cognitive or personality factors. So this could be having low self-esteem, negative thinking patterns, which we'll talk about in just a little bit more. Having life transition. So maybe going through a new job, retirement, maybe the kids have moved out of the house, things like that. General sleep disruptions, so trouble falling asleep or staying asleep, could be diagnosed with sleep apnea recently. And a couple other things are just having a lack of nutritional deficiencies, so maybe lacking vitamins or things that you need. Feeling burnout or overloaded, could be at work, could be academic, maybe you're in school, or just having perfectionism. And then finally, grief or loss and financial stress are kind of our last two triggers for depression. With this, sometimes comes our common negative thoughts or beliefs. So we might have the beliefs that, we're worthless, that we're a failure, things won't get better, nobody cares about me, everything's falling apart, nothing makes me happy, I can't enjoy anything. So when we pair those triggers of those situations with depression and those thoughts, those really start to kind of feel very overloaded. So when these things happen, we want to seek help. So The wonderful thing about Cummins is that we offer same day intakes for our adults and youth seeking outpatient treatment. And if they're interested in school-based treatment, we can call the number 888-714-1927 and get set up with an intake specialist or therapist to help manage these symptoms of depression. Some things that we will learn though in treatment and things that we can also do at home if seeking treatment, we will do therapy. So some of the therapies included to treat depression are cognitive behavioral therapy, where we'll really focus on examining some of those beliefs and thoughts and how they pair with behavior. The second is dialectical behavioral therapy. So this is kind of a combination of some mindfulness with some CBT kind of mixed in to really help kind of understand emotional regulation, how to be mindful, how to manage distress, and then how that impacts your interpersonal relationships as well. Another one is solution focus, where we focus really on problem solving and solutions instead of the problem itself. And then interpersonal therapy is a really good therapy, especially if you've had experienced grief and loss concerns. Some other things that we work on is a lot of different coping mechanisms, such as exercise. So even walking 5 minutes a day can help improve depressive symptoms. So this could be walking, yoga, jogging, kickboxing, things like that. Anything that kind of keeps you moving. We talk about healthy lifestyle as well. So really, when we talk about depression and really any mental health diagnosis, we want to think about making sure our body gets what it needs. So having a well-balanced diet, having a good sleep hygiene routine, things like that can really help improve overall mood. Looking at social support systems. So even if you're struggling with feeling connected with loved ones, looking at this piece in treatment can be really helpful. So if it's not with family, it could be a support or an interest group, getting involved in that to really be around people that have the same common interests as you. We work on mindfulness and relaxation as well. So different things to meditate, deep breathing, doing some self-care kinds of things related to that. Journaling. Sometimes it's hard to talk about things. So writing can be a great way to process emotions and get some of those feelings out. A lot of times, we're set with certain goals with work and school and things like that can feel so overarching. So working with someone to help you set achievable goals, breaking those things down into manageable steps can be one way to really help us feel like we can accomplish those things. Limiting negative influences. So getting yourself off of social media for some time, avoiding toxic relationships, really those things that can really bring you down and increase those depressive symptoms. We want to have some time away from those kinds of things or reduce those altogether. Trying to get back into those pleasurable activities that you once enjoyed. So even if it's for a short time, it doesn't have to be hours and hours, but just being able to say like, hey, I did this for 10 minutes and it was really nice to do that again. Practicing self-compassion is another one. So making sure that we're being kind to ourselves and that we're not putting ourselves down, even for trying. Because I think sometimes that's a big piece is that we feel like we can't do it the way that we used to do it because depression is kind of taken over. And so being kind to yourself is a really important piece in working through depression. A lot of times we can feel like we're not ourselves anymore and we feel like we're sometimes outside of our body. So we learn different techniques called grounding techniques that really help us to be present in the moment. And this method, the 5-4-3-2-1 method, really helps us to engage our 5 senses. So we start to kind of name things that we see, that we smell, that things that we can touch, things like that, things that can really keep us present, focused, and engaged in that moment. Some people will use spiritual practices too, like prayer and meditation to help with depression. And the last two on here, really you'll see this kind of as a combination with anxiety as well, but limiting alcohol and caffeine is really important. We want to do this in moderation or avoid it altogether because of how this works in the brain. And the last thing is just practicing gratitude. So kind of like self-compassion is really important to practice gratitude, not only for others, but for yourself. So sometimes keeping a gratitude journal can be really helpful in being able to just improve those symptoms. So those are some of our coping strategies for depression that you can do at home, but also some things that you can do when you're in treatment here at Cummins. Let's move on to anxiety. So anxiety, you may see will have some similarities, not so much the symptoms as much, but some of the coping mechanisms, some of the triggers can be similar with depression as it is for anxiety. But let's take a look at anxiety a little bit further. So when we look at our symptoms for anxiety, we're really looking at that excessive anxiety and worry. So we're just kind of feeling keyed up more days than not. And this has to be for at least 6 months. So not so much your short term, but a little bit longer term. And this anxiety and worry is about a number of different events or activities. So it could be work, could be school performance, could be related to any life changes, things like that, but be for a significant amount of time. When someone's experiencing generalized anxiety disorder, they have a really hard time controlling the worry. So it's gonna come out in a couple different ways. And remembering too, when we're talking about adults versus children, the symptoms may look a little different as well. So as far as the symptoms and how they kind of come out, you might feel restless or keyed up or on edge. So there's a similarity with the depression piece there too. Being easily fatigued, having trouble concentrating in your mind, going blank more times than not, feeling irritable or just kind of on edge that way a little bit. Things that didn't used to get you irritated may irritate you now. Having muscle tension, and then finally that sleep disturbance piece. So it could be difficulty falling asleep, staying asleep, just feeling restless, unsatisfied, have a lot of thoughts kind of rolling through your brain when you're trying to go to bed or when you're waking up in the middle of the night. Again, this has to cause distress or impairment in either social relationships, at work, at school, or other important areas of life. Could be in parenting, family, things like that as well. And again, not being under the direct effects of a substance. So that is generalized anxiety disorder. Let's talk a little bit about those triggers like we did with depression. So some of our triggers for generalized anxiety can come in the way of stressful life events similar to depression. So it could be related to job loss, relationship issues, financial problems, things like that. Could also be related to health concerns. Maybe there's a new diagnosis, again, chronic illness, cancer, pain, any health issues, any new things that might be triggering some of that anxiety. Could be that pressure from work or academics. Maybe there's a lot of deadlines or performance expectations. Maybe there's a raise on the line, things like that, or making partner, things like that at work. Family or relationship conflict. So a lot of times, sometimes during the holidays, this could be situational triggers, but also just ongoing marital problems, parenting challenges, things like that. Maybe there's some unresolved trauma or past negative experiences that we haven't worked through yet. So it could be from childhood if you're an adult, or maybe there's abuse going on. Any major life changes where there's moving, divorce, marriage, obviously there's going to be your typical anxiety that comes with new experiences. But when it starts to cause that distress and starts to impair those other areas, that's when those major life changes have really kind of taken over and that anxiety is too much. Uncertainty or lack of control. So really not knowing what the future holds and things like that. And that's just really on your mind, and it's really getting in the way of you being able to do your day-to-day tasks. There could be social situations too. So maybe you have to do a public speaking scenario, like at work or things like that, and you're terrified of public speaking. Or maybe there's a social interaction that you're getting ready for that you're just not sure of. Maybe you have fear of being judged by somebody. So those situations can be really anxiety provoking. Maybe there's some financial worries going on. So maybe having some job insecurity, or you're in debt and you're just trying to figure out how to get out of debt. And again, too, with caffeine or substance use, this can increase that anxiety piece too. So when paired together, like stimulants, alcohol use, you may experience withdrawal symptoms, or again, feeling more anxiety or feeling more keyed up. Again, with some of those situational anxiety kinds of things, there's also the thoughts and beliefs that can be kind of triggered with that. So we're looking at that. It's a little bit different with our anxiety thoughts versus depression thoughts, but there can be some overlap. Our anxiety thoughts can sometimes look like, what if something goes wrong? We're thinking about kind of the worst case scenario happening. So that kind of that catastrophizing. Fearing that I can't handle this, or I'm losing control, or I'm going out of control. Am I making the right decisions? So some of that indecisiveness from depression, we also see that in anxiety. Can't get your mind off something, can't stop thinking about something. I can't predict what will happen next. So when those thoughts are triggered, it can sometimes, take that toll, and that's all that we're thinking about. So we get very stuck on that, and we have a hard time getting off of that thought and challenging that thought. So that's another time too, when it's helpful to get help. So again, just like before, we have same day intakes for those that are seeking outpatient treatment at Cummins. And then for our school-based consumers, we also have the Cummins line to call to set up an intake to get help for anxiety. So we can help with both anxiety and depression. But some of the things that we'll learn in treatment, just like we did with depression, we'll learn some things to manage anxiety. So one of the key treatments for generalized anxiety is cognitive behavioral therapy. So when we are working with in CBT as for short term, this is where we start to challenge those negative thought patterns and the worries established with that and how that impacts our behavior. So if we change the thought, we can change the behavior, we can change the emotion associated with that. So that is one treatment that we would do here at Cummins. Another thing that we would do that we would also encourage to practice at home is mindfulness and meditation. So practicing staying in the moment to help reduce that overthinking. Another thing too, relaxation techniques are key. So using deep breathing. Breathing is such an important piece in managing anxiety and managing a lot of things, right? So paying attention to your breath. We'll do progressive muscle relaxation so you can feel the difference between what it feels like to tighten a muscle and relax a muscle. And then we also do some guided imagery to help with reducing that physical tension. And those are all great things because you can do that at any time. Another thing is exercise. So just like with depression, engaging in regular physical activity can help reduce that stress and improve overall mood and also help with that anxiety piece as well. Again, limiting caffeine and alcohol or just taking that out completely can really impact anxiety. So we want to make sure that we are limiting that. Having a structured routine. So sometimes when things feel like they're out of control, having a good routine can be really helpful. We want to also understand the importance of flexibility, but having some structure in a day can be really helpful. So having some of those set daily goals, breaking those tasks into manageable steps, that can help that ability to avoid feeling overwhelmed. Social support, again, is key, just like it was in depression. So talking with friends, family, a therapist, having an interest group, somewhere where there can be that social support and also a really good way to have some self-care too. Sleep hygiene, again, is key. So we want to make sure that we are taking care of ourselves, not only with sleep, but also that balanced diet again. So prioritizing good sleep habits, maintaining emotional and physical health with that can help with that anxiety piece. And finally, journaling. So again, sometimes it can be really hard to talk through our thoughts and feelings. So being able to write those worries down and release them and gain some clarity, sometimes writing out pros and cons, things like that. So it doesn't just have to be a journaling prompt or just about your day, but some very specific writing strategies can be really helpful to manage that anxiety. And finally, doing mindful distraction. So this is one of our distress tolerance skills that we learn, but engaging in hobbies or activities that can redirect our focus away from those anxious thoughts until we're ready to kind of problem solve through them. So those are some of our strategies that we work on when we're talking through generalized anxiety disorder. I want to thank you all for taking the time to learn more about depression and anxiety. And if you have any questions at all, please reach out to Cummins Behavioral Health.